And if it's anything Asian, I love it. Yeah, I like any type of Japanese, Thai food, sushi, not raw. I don't do raw. But okay, wonderful. Well, good morning, everyone. I didn't know how large of a crowd we would have this time. We had to cancel the diabetes talk last fall. I had to cancel, and it was a good thing because I think that was the day that there was a water leak upstairs. So we decided to combine the diabetes talk with National Nutrition Month. So March is National Nutrition Month, and so I actually have two slideshows. I'm going to start with diabetes. It's interesting, we here at River Landing are very fortunate. In the patients that I take care of, we do not have a very large population of patients with diabetes. And I think that speaks to several things. The health of our residents has maybe always been a priority. I believe we are in a very fortunate population here at River Landing, and I hope you all could agree that you've probably, for the most part, had very good access to health care throughout your life. Maybe not always, maybe not as a child or something, but in your adult life, you have probably had great access to health care. And so with that, we tend to find people who are healthier later in life. If they've had those good practices instilled either in childhood or teenage years, and if not, they develop them in their early adult years, and then it carries over into retirement. So we're going to start with diabetes today. I'm going to angle myself, hopefully, so that I can see everyone. You guys know I like to call people out by name and ask questions sometimes. So Carrie sitting on the front row might get tested today. But I can point. But for those of you who don't know me, my name is Lori Saunders, and I'm a physician assistant. I work with Curana Health, and we operate a clinic here at River Landing on site. We have a primary care clinic, and so we provide primary care services to any resident who wants to use the clinic. I know many people still maintain their outside primary care provider off-site, and that's perfectly fine as well. We can provide some secondary care to you if you have maintained your PCP, but I'm not sure what that is. Remind me later. That's a good choice. But I do know many of you because I am your primary care provider, or you also see Dr. Blake, who's my supervising physician, and we work as a team. But we are right here on site for those that don't want to go off site. So understanding diabetes, we're going to start with the different types of diabetes, sort of what's happening inside of the body that causes this. Then we will talk about some of the treatments. I'm not going to get very detailed into that because this is not like a diabetes support group where everyone in the room has diabetes and they're interested in the various levels of treatment. So we won't get into a lot of the detail about treatment. I'll kind of generalize a lot of that. We'll talk about nutrition. And then, of course, my second slideshow will be more dedicated towards nutrition. And if you hang around for the end of it, I don't want it to be a mass frenzy, but everyone can come up and help themselves to the vegetables and fruits that are on the table. I brought it, but I'm not taking it back home. So please take something home with you. I think last year at the end of the presentation, we had a few random strawberries lying around. So please feel free to take something home with you. So the first question is, what is diabetes? Because if you don't have diabetes, you may not know what diabetes is. But it's a condition where the body has trouble using the glucose or the sugar for energy. And when this happens, there's either not enough insulin or the insulin isn't working well. So the first body part or organ that we think about is the pancreas. The pancreas is not something that people come in with saying, my pancreas hurts, or I'm having a problem with my pancreas, because most people don't know what does a pancreas even do. But it sits in the central part of our upper abdomen, and it helps to produce insulin. It has other functions as well. But in type 1 diabetes, it's a problem where the body doesn't make insulin. So if you've ever heard of juvenile diabetes or type 1 diabetes, we tend to think about that as the type of diabetes that is diagnosed at a young age, either in childhood or as a teenager. But type 1 diabetes can be diagnosed midlife, I should say, because it could have been missed, or it just really didn't manifest itself or present itself until someone was a little bit older. I have a good example of this, and that's my sister-in-law. So my sister-in-law had graduated high school. She was doing cosmetology school. She was in the process of working as a hairdresser in Ohio, and she felt horrible. She was in her 20s, and she felt so sluggish. She couldn't get out of the bed. She was exhausted. She had some of the typical symptoms of urinating frequently, being very thirsty. She said she would stop on the way to work and get something to drink. She was drinking at work, and she couldn't make it home without stopping to get something else to tide her over till she got home. So she was constantly thirsty. Finally went to the doctor, and she was diagnosed with type 1 diabetes. And so that's where her body just was not making the insulin that it needed to help lower the blood sugar. Type 2 is something that we typically see later in life. I usually say kind of midlife and later, but we are starting to see type 2 diabetes in children. And what that means is the body can't use the insulin properly, and so it can't use it to lower that blood sugar. Oftentimes when we see type 2 diabetes, we will often see some overweight children, overweight adults, or what we call truncal obesity, meaning that someone can have thin legs and thin arms, but most of their weight is in their trunk. It's in their midsection. And so that, not always, we have type 2 diabetics who are very thin. But uncontrolled blood sugar can affect many of our vital organs. The number one, the heart. Pretty vital, right? If that heart is not working, then that can lead to other conditions. It can lead to, if the heart's not pumping accurately, then our brain's not getting the oxygen that it needs. Our other organs, muscles are not getting what it needs. So the heart, I would say, is the very most important organ when it comes to diabetes. So having diabetes can increase your risk of heart disease. If you already have heart disease, it can complicate the heart disease further. I have had patients who have undergone coronary stents placed in their heart arteries. I've seen people to have had heart bypass surgery, maybe before they were even diagnosed with diabetes, later in life develop diabetes, and I've known those patients to go back and have to have a second open heart surgery because those heart arteries get hardened and blocked again in the future. Another very vital organ are the kidneys. As we all know, the kidneys filter our system, and so it filters our blood, removes the toxins from our blood, puts it into our urine, and if our kidneys fail, they aren't producing the urine and they're not eliminating the toxins, so we get a buildup of toxins in our system. Kidneys are very vital. We know that if they don't work, then stage 5 kidney disease is where your filtration system is so poor that patients often need dialysis. And so those toxins can build up. They can damage the heart if you don't have dialysis, and then eventually, the heart stops and your other organs fail as well. So the kidneys are what I would consider your second most important vital organ when it comes to diabetes. The eyes and the nerves are sort of in a running for third place for me, because I think we all know that we could be blind and still live a good life. It would be very different from the life that we live now if we didn't have our vision, but there are people born without eyes. There are people who have to surgically have eyes removed. But we know that we can take healthy eyes, and with a development of diabetes and uncontrolled diabetes, people can lose their vision. So you can have blindness as a result of uncontrolled blood sugar or diabetes. Nerves. If anyone's ever heard of peripheral neuropathy, has anyone ever heard of that or has that? Peripheral neuropathy, when the nerves are irritated, then they don't feel right. That's the best way I know to describe it. Neuropathy can happen in the fingertips, the toes, but it can extend. You can have neuropathy up your arms, you can have that up into your feet and up your legs. And I always tell people, the initial thought about neuropathy is, the first question is, are you diabetic? Because blood sugar impacts these tiny nerves and causes the nerves to have aching type pain. Some people describe it as a burning sensation, but ultimately what you have is you have loss of sensation. So the first question is, do you have diabetes? The second is usually, have you had chemotherapy? Because we know that drugs, medications, can cause neuropathy. And so if someone comes to me with numbness, tingling, pain, they describe it as a burning sensation, whether it be in their hands or their feet, my thought process goes with, let's check their blood sugar. We've got to know what their blood sugar is. We need to know what their hemoglobin A1C is, and we'll talk about that blood test in just a moment. There's other things that can cause peripheral neuropathy. Spinal disease can compress nerves, which then cause neuropathy. But in terms of diabetes, uncontrolled blood sugar can greatly impact your heart, your kidneys, your eyes, and your nerves. I want to go back to the heart for just a moment. So we know that the heart is a muscle, sits in our chest, and it pumps blood out to the rest of our body. It does that by pathways of our blood vessels, our arteries. So our arteries go out away from the heart. Our veins return blood to the heart. That's why when you check for a pulse, you're feeling for the artery. You're feeling for that carotid artery, that radial artery, to get that squeeze where the blood is going out. When I talk about diabetes, I often talk about how it can increase our risk of stroke as well. So some people might say, well, why is brain not up here? Well, I kind of combine the brain with the heart. It's going to be due to the blood flow that reaches the brain. It's going to be by way of those arteries. If you have blockages in your heart arteries, or you've had heart surgery or stents placed, you very well may have plaques or blockages in your other arteries in your body. Maybe going to your legs, maybe going to your head and neck. And so any vascular plaques in those areas can limit the blood flow to the brain. And the brain's a very vital organ. I think one of the biggest fears that I see here at River Landing are people who are concerned about their memory for good reason. We want you to stay independent. You want to stay independent. And when you start to see forgetfulness, that becomes very concerning. So one of the things I often do when I'm doing your exam is I'm listening to your carotid arteries to see if I hear any evidence of plaque buildup. So I combine the brain being a very important organ when it comes to diabetes, but I kind of link it with the heart. And it just sounds strange because the heart's a muscle that's pumping blood, but the brain is one of the organs that receives that. So the good news about diabetes is healthy habits, treatment, all of these things together can help manage blood sugar and diabetes. The number one treatment for diabetes is diet and exercise. The number one treatment for high blood pressure is diet and exercise. The number one treatment for heart disease is diet and exercise. The number one treatment for dementia or increased brain function is you took the words right out of my mouth. So if you haven't heard me say before, but diet and exercise is pretty important. It's pretty important for us to maintain our health, diabetes, heart disease, brain health. It's very important to maintain our mental health as well. So common symptoms of diabetes, and most of you who see me, we do a screening at least once a year for diabetes. So many of you already know I don't have it, or I maybe have pre-diabetes. Now this is a tricky one in our population because I know many women who get up at night and go to the restroom, but many more of my gentlemen, male patients, have to get up and go to the restroom. That's usually related to enlargement of the prostate, but frequent urination would not be isolated only to nighttime. This would be your body is trying to dump out the glucose that's in your system, and you are having to urinate. So you're having frequent urination throughout the day and night. Blurred vision, we talked about how the eyes are an organ that can be affected by diabetes. So someone who has uncontrolled diabetes or has not been diagnosed as diabetic, they could have blurred vision, and that could be one of their presenting symptoms. Feeling tired. Who in this room ever feels tired? I know why I'm tired. I burn the candle at both ends. I just know it. So, but you know, we age, we get tired. We have a health condition that makes us tired. We might take a medication that makes us tired. So feeling tired in and of itself is not indicative of diabetes. You have to look at the whole picture. You have to look at the patient. You have to look for all of these symptoms. But feeling tired can be a symptom. As I mentioned, my sister-in-law, who was in her 20s when she was diagnosed with type 1 diabetes, she could barely put one foot in front of the other. And you know, it ended up changing her career because she got out of doing cosmetology and being a hairdresser. And even a few years ago, when she was thinking about going back into it, she said, "Lori, I just can't." She said, "It reminds me of a time in my life when I felt my worst." And so she just said, while that would be a great career for me to pick up now that my children are out of high school, going to college, go back doing hair, I just can't. I mentally can't get over how I used to feel when I was an uncontrolled type 1 diabetic. And, you know, that impacts, you know, our illnesses, our diagnoses, our health conditions impact how we feel, both physically, but then it can also impact us mentally. Common symptom of diabetes can be delayed healing. So slow healing cuts, slow healing wounds, slow healing from a surgery that you may have had. One of the things we talk about with diabetics is protecting your feet. It goes back to that nerve problem I talked about, how you may have decreased sensation in your hands and feet. So walking barefoot as a diabetic isn't always recommended. You can get a cut or an abrasion on your foot, and because you don't have that sensation that another person might have, you're not aware of it. It goes undetected until it becomes infected or becomes to the point of needing further treatment, like debridement or sometimes even amputation of a toe. So diabetics are usually discouraged from going and getting their nails done, like pedicures, or walking barefoot at the beach. Even walking barefoot in their home, they could step on something and have an injury to their foot. So we just try to remind diabetics of these things. Healthy living with diabetes can mean several things. What did I say a little while ago? The initial treatment for diabetes is diet and exercise. So diet, eating smart, choosing grains, lean protein, vegetables, and then you notice it says fruits in moderation because fruits are high in sugar. Would I prefer you to have a piece of fruit or a piece of cake after dinner? Fruit. Some of this everyone already knows. It's the stuff we know, but maybe we don't necessarily do. Moving regularly, that's where the exercise comes in. Even gentle activity can help manage your blood sugar. So if you are going from a lifestyle of sitting, then that means getting in more steps. If you're not able to get in more steps, it might be increasing your chair activities. So while you're sitting and watching television, you have a can of soup in each hand and you're doing bicep curls. Or you have a little 3-pound, 4-pound, 5-pound weight sitting beside of your recliner and you're doing arm exercises. I'm not a fitness instructor. Jill can help us with that, but Jill has chair classes. She has a lot that she can help you with if you just need to move more, but you physically can't move your feet one in front of the other or carry your body weight around any more than what you're doing because you're limited with back pain, foot pain, neuropathy, hip pain, joint pain. So there are other areas of movement that you can look at. Checking your blood sugar regularly, having a home monitor for some people means checking their blood sugar, in the morning before they eat or checking it at night. There are now also what we call continuous glucose monitors for those of you who have sometimes seen often a diabetic, but I have other people who are wearing them because they are so interested in which foods cause their glucose to go up that they're wearing a continuous glucose monitor to monitor which foods cause spikes, and it allows them to really regulate their diet well. Healthy living also means taking medications or insulin if prescribed that can help lower the blood sugar. It can help lower the A1C. It helps reduce the risk of heart disease, brain disease, things of that nature that are affected by diabetes. Smart eating tips, we're going to talk a lot about this. You all see I only brought fruits and vegetables today. There's no cookies, there's no candy, there's no donuts, Carrie. Kimmy's known for bringing donuts sometimes to River Landing, but not Lori. Limiting your added sugar and sweets. Having an apple is going to be better than having a piece of cake. You're getting fiber, you're getting wonderful nutrients from that apple. I know it's not quite as good as that piece of cake, but anything that grows from a tree, a plant, or comes from the ground is going to be more healthy for you. Again, over the past 15 months since I've been here, you all have heard me say boxes and bags are not our friends. So if it comes from a box, a cake mix. If it comes from a bag, candy. That's not going to be as healthy for us as something that came from a tree, a plant, or from the ground. So limit adding any extra sugar or sweets to your diet. You're going to want to watch your portion sizes. I was thinking about this last night as I was driving home, and I'm not feeling very hungry, but my husband was off of work, and he had made a pot roast and carrots and mashed tart on his day off to prepare our family for dinner last night. But I was thinking to myself, dinner plates, why are they so big? You know, if you think about the size of our stomach, we don't need a dinner plate. We all really need a salad plate. We need a salad bowl size type portions, not an overwhelming large amount of food, unless you're just going to plan to save it. Fraction it off and save it for future meals. But most people, even in restaurants now, if you ever look at the portion sizes, they're humongous. My husband and I often will share a meal together. We were on vacation last week, and I said, do you want to share a meal? Because neither one of us were feeling super hungry that evening. Why waste the money? Why waste food when you can share and take in smaller portions? In your diet, you want to include fiber-rich foods. That's not only going to help your digestive system and help prevent constipation, but it's also going to help with your blood sugar. And then diabetics are going to want to avoid skipping meals. If anything, I often will talk to diabetics about eating frequent small meals to maintain their blood sugar. And I will also talk about eating protein at every snack or every meal. Protein can help stabilize blood sugar so you're not having spikes and plummets. And so having a high protein diet will help stabilize that blood sugar. So again, staying active, walking, chair exercises, gentle stretching. You want to aim for 20 to 30 minutes most days. You're in a wonderful facility who offers that. Jill and the Wellness Center and all of the circuit classes and the machines, the studio fitness classes. There's so much available here to keep everyone moving and active. If you're not engaging in at least something that the Wellness Center offers, I would encourage you to get involved. That is one area. Remember, diet and exercise. We're taking part in what the bistro and the restaurants offer, but we need to make sure we're also taking part in what the Wellness Center offers. Activity is going to help control your blood sugar. It's going to give you lots of other healthy benefits. It's going to keep your joints healthy. It's going to keep your blood flowing through your vessels. The more forcefully the blood flows, then the less chance of building up with those plaques within the arteries. So I do say that some aerobic exercise is good, whether it be from a seated position or standing position. You want to do some aerobic activity in your daily lifestyle. You'll want to check in with your provider. There are several things that we need to look after when someone has diabetes or we're screening for diabetes. Usually that involves blood tests, and so that's not up here, but I'm going to talk about blood tests first because that's how we diagnose diabetes. That's how we monitor the progression of diabetes, or we're monitoring someone's success in lowering their blood sugar, is through blood tests. So they can be done finger stick glucose. That's when someone has a glucometer at home and they do a finger prick, put their blood on the little test strip, stick it in their machine, and they find out what their blood sugar is at that moment. I always say it can change 30 minutes later. It can change an hour later. It can change later in the day. So it's only a snapshot of what the blood sugar is doing right in that moment. That is one way to check the blood sugar. One of our common blood tests that we do is a chemistry panel, a comprehensive metabolic panel. That includes a glucose level. That is also can be done and sent to the lab. Again, that's a snapshot of what the glucose is at that moment that you had your blood drawn. Another blood test, though, that many of you might be familiar with is the A1C level, the hemoglobin A1C level. And that will monitor diabetes. It tells us, first of all, is a patient normal? Are they pre-diabetic? Are they kind of having this rising blood sugar and they may eventually get diagnosed with diabetes? Or are they already in the diabetic range? So if you're in the diabetic range, that's oftentimes when we start talking about therapy with medications. Because if you're normal, we should all be dieting and exercising. If we have pre-diabetes, where we're starting to see those warning signs that the blood sugar is being elevated, we should all be dieting and exercising. If you get diagnosed with diabetes, you should be dieting and exercising. But that is oftentimes where we bring in medications to help, because we are seeing that diet and exercise alone are not controlling the blood sugar, and so we know that blood sugar is then going to damage organs. So blood test, that's one way of partnering with your healthcare provider to look after yourself. Annual eye exams, so with your optometrist or ophthalmologist. If you're diabetic, you should have a dilated eye exam every year. That means you got to get dilated. No one likes to be dilated. I can't stand it. But you got to go. You got to get the drops put in your eyes. They dilate them so that they can look at the back of the eye and they can see if there's been any damage to the eye from blood sugar. So a dilated eye exam every year. Foot checks are very important, so looking between the toes, looking under the foot, which not everyone can do, making sure that the nails look okay, that there aren't any areas that are bleeding, that are cracked, that are dry, that need attention. So getting foot checks either with your primary provider or with a podiatrist are very important. Some people who have chronic kidney disease and diabetes also need to see a kidney specialist. So a nephrologist is a kidney specialist. So there's various different healthcare providers that can help with managing diabetes. The good thing about diabetes, I tell people it's the same with cancer. Most people are very alarmed when a cancer diagnosis comes, but how many of us know someone who has had cancer? A lot of us. How many of us know someone who is living with cancer? Maybe they don't need treatment, but they're constantly being monitored for it. I tell people that diabetes is not a death sentence. Cancer is no longer a death sentence. Sure, no one wants to get the diagnosis of diabetes. No one wants to get a diagnosis of cancer. No one wants to get a diagnosis of dementia. But with the treatments that we have, people live very long, fulfilling lives and can remain independent for a long time if we're doing the right things. So again, living well. Many people with diabetes live full, active lives. Can anyone tell me right now if anyone sitting beside you is diabetic? You can't look at someone and know, can you? And so you can down at the clinic, on-site primary care, sick visits, ear cleanings, blood pressure checks, referral to specialists, medication management. Your health is our priority. So I remind people when I'm recommending something, I educate patients first, and then when I'm recommending something, it's because if you were my mom or if you were my dad, this is what I would want you to do. This is what I would recommend. So I am here to help any way that I can. Christine, if we could switch over to the other slideshow. She's going to get the other slideshow up. I'm not going to spend, this is a short one, I'm not going to spend a lot of time, but we wanted to, for those of you who have joined us late, we wanted to incorporate talking about diabetes with pulling in National Nutrition Month because they go hand in hand. The initial treatment for diabetes is diet and exercise. So I'm not going to teach you how to exercise up here, but I can instruct you on eating well. So you all may remember this slideshow from last year. I updated it some for this year. I think this photo is so cute. Makes me want to go make a pair of little glasses with pepper rings. But this is talking about healthy eating through our golden years, trying to nourish our bodies. So the importance of nutrition is maintaining our energy levels. Where does our energy level come from? Well, what we're bringing into our body. So if you're bringing in good, healthy nutrition, then it's going to give you good energy. I tell my kids, you bring in junk, it's going to put junk out. You're going to be in a bad mood. You're going to be sluggish. You're going to be grumpy, irritable. You don't feel good. You may not recognize that that's what it is, but the people around you can recognize that that's what it is. So what you bring in has to be healthy so that what comes out of our mouth, what comes out of our body is healthy. So that's going to help your energy level. It's going to support you physically, and it's going to support you mentally as well. The major nutrients that we think about when we're talking about people who are over the age of 65 are these 4 categories: healthy fats, lean proteins, carbohydrates, and fiber. And some people, maybe don't have a background in nutrition. I don't. My background is not in nutrition. But through working as a healthcare provider, I know what our body needs. I know what it needs more of, and I know what it needs less of. So the nutrients to focus on, you want to increase your protein intake for muscle building and muscle maintenance. Why do you think bodybuilders eat lots of eggs? Because it's high in protein. Why do they drink protein shakes? Because it's going to help build their muscle. So as we age, we are losing our muscle mass. We are getting weaker if we're not constantly building it. So it's one of those, if you're not using it, you're losing it. And what do our muscles do? Well, they help us maintain our posture. They help us maintain our stability. They help us maintain our balance. We can get up from a chair. We can bend over and pick something up. So you want to make sure that your muscles are good and strong. Calcium and vitamin D for bone health. Many people are aware of osteoporosis or osteopenia that can happen as we get older. We lose our bone mass as we get older. So taking calcium, taking vitamin D, and lifting weights, strengthening your muscles helps strengthen your bones. Fiber is going to be for your digestive health, so think about roughage. Think about these types of foods here that are going to help add fiber to your diet. Vitamins B12 and B6 are going to be great for the brain and also for energy. And then omega-3 fatty acids can be good for heart health. So these are just some of the nutrients that we like to focus on as we age. You'll see here in this picture, sometimes these are just for illustration, but I think they're actually fairly good. Avocado is a healthy fat. Coconut, healthy fat. Salmon, healthy. So take a look at those photos as you think about protein timing. So when we think about muscles and we think about protein, there's reasons we lose our muscle mass. But I just mentioned from the diabetes talk about spreading the intake of protein across meals throughout the day, across your snacks throughout the day. One, it's going to help you to absorb that protein better. If you're not just getting protein in one lump time, like you're only getting protein at breakfast and not the rest of the day, if you're getting it throughout the day, your body is going to be able to absorb that better than just being socked with protein one time a day. So you're going to want to spread that out throughout the day to help with absorption and to help with muscle synthesis. But it also helps with the highs and the lows of blood sugar. Best sources for protein, we think about animal-based and plant-based. A few moments ago, I talked about if it comes from a plant, if it comes from a tree, if it comes from the ground, that's natural. And so we do think about how we can get protein from some of those plant-based items. That's a good list there. And then animal-based. So I always say, what should our diet be? Well, if it comes from the ground, a plant, that's going to be healthy, or if it has a mother. Animals have mothers, right? They don't get here by chance. Every animal is born. It's hatched. So things, eggs, chicken, turkey, beef, fish, all of those things are going to be great animal-based proteins. What about Greek yogurt, cottage cheese, low-fat milk? These are all dairy, but where do they come from? Cows, typically. You can get sources of protein from plants. That's why we see now that there's almond milk, there's oat milk. Different things are going to provide us with different sources of protein. I have a list from Johns Hopkins in the clinic, and I could have brought that today. I didn't think about it, but if anyone wants one, feel free to stop by. It gives you an idea of the most common foods, and it tells you how much protein is in them. It's not an all-inclusive list, but it's good to kind of look and say, I need a snack, and I need something high in protein. What should I eat? You can look at that list and go, I think I'll go eat a boiled egg. I think I'll have some peanuts. I think I'll have some Greek yogurt. So if anyone wants one of those, feel free to stop by the clinic. Incorporating protein into your meals. Breakfast, think about eggs, toast, spinach, Greek yogurt, and berries. Lunch, think about chicken or tofu on top of your salad. Think about a lentil soup with a side of crackers. Dinner, think about salmon. Want to incorporate your vegetables as well. Snack ideas, a handful of almonds, cottage cheese with fruit. Things like that can be high in protein, so that's a good way to get those into your diet. Vitamin D, you can take a pill. You can also expose your body to sunlight. That can help your body to produce vitamin D, but dietary sources, fatty fish, fortified milk, and there's your sunlight. Omega-3 fatty acids, you can take a supplement, but if you're wanting to get it from your diet, you want to focus on salmon, walnuts, and flax seeds. And then the B vitamins, again, you can take a vitamin supplement. I prefer people get their supplements from their nutrition, not from a bottle. But you can get it from eggs, cereals, leafy greens. Nutrition plays a role in so many of our health conditions, as I said. Diet and exercise, diet and exercise, diet, diet, diet. Diet plays a role in diabetes, hypertension, heart disease, osteoporosis. So if you want to focus on good health and not just heart health or not just low blood sugar, you're going to want to have a good diet. So again, what we bring in is going to help us in how we feel and what conditions we get diagnosed with. I'm not going to go into the details of these, but I think we know that diabetes is high sugar, so you focus on low sugar. Hypertension is oftentimes increased from salt or sodium, and so you have to focus on low sodium diet. Heart disease can come from foods high in saturated fats, so you have to focus on foods that are low in saturated fats. Osteoporosis can come from a deficiency of vitamin D and calcium, so you have to think about things that are high in calcium and vitamin D to help build your bones. Does anyone ever remember seeing these healthy eating plates? You think about your plate as a divided dish. Where you should have a fruit, you should have some form of grain, protein, and vegetables. There are various different diets out there. There's keto diets. There's different diets that are focused on eliminating different portions of this. There's a carnivore diet that talks about only eating meat. There's the keto diets are eliminating these top two. You mostly would probably eat vegetables and meat and eliminate fruits and grains. I still believe that a balanced diet, everything in moderation. You don't want to eat a little bit of protein and then eat the rest of your 3/4 of your plate full of starchy carbohydrates or grains. So everything in moderation. There's a lot of apps out there for iPads, for your computer, for your phones. They can help you with eating healthy. If you want any of those ideas, let me know. Who thinks this looks like Miss Foster? I mean, I was zooming through these the other night preparing, and I said, that looks like Maxine. It just caught my eye. And that sweet smile, right? She's got the sweetest little smile, and I love her laugh. But if you need ideas for technology, I think Philip, our IT guy, might have some recommendations for different apps. Elaine, do you have any apps you use or recommend? I hate to call you out, but anything that you like to track with or check nutritional information with? My Fitness Pal, I have used that one, and My Net Diary. Lose It. Okay, so that's another application. So My Fitness Pal, My Net Diary, and Lose It. You can check your iPad, your phones for that. Here, I did know that My Fitness Pal was on here. Chronometer monitors your vitamins and minerals with detailed information. Some of the cooking and recipe apps, I don't know how many people are cooking here. I think some people still try to, but it's so easy at River Landing to have someone else cook for you and to go to the bistros and the restaurant today. But diet, exercise, and water. Diet, exercise, and water. Eating healthy, movement. Movement is medicine, and hydration. Hydration, hydration, hydration. So there are some apps that can send you reminders to drink. My watch used to tell me to breathe. Did anybody ever have that? It quit doing that. I don't know if it's because I quit listening to it, but it used to pop up and it would tell me to breathe. Say, okay, I need to take a big deep breath, but maybe I need to get the hydration reminder to tell me to drink, and then I can sip water. Activity can come from different things. So I tell people, again, movement is movement. So it may not get your heart rate up really high, but even things like gardening, if you're living in one of the cottages and you love your flower gardens or you have a produce garden, that counts for activity. So just movement of any kind. You just don't want to be sedentary. We talked a little bit about resistance training, using bands, using weights, using soup cans. I mean, you can use what you have. You don't have to go out and buy things. Walking, bearing weight. I've talked in the past about buying a weighted vest that you can use, that you can take weights out of or add to, that can help strengthen your bone density. So that would be great for osteoporosis or osteopenia. And then focusing on balance, because if we focus on balance, then we're lessening our risk of falls. I have another talk coming up towards the end of the year where we're going to talk about balance and falls again. But I just did want to add a couple of these slides into the nutrition because it's so important. So again, just keep that water coming. And you can get hydrated even through the foods that you eat. Just like there's foods that can dehydrate us, there are other foods that will hydrate you. So fruits and vegetables that have a high content of water can also hydrate you. So it doesn't always just have to come in a glass. Again, a few moments ago, we had a couple ideas like cottage cheese, things that have high in protein, but just healthy snack ideas. Try to remember to go for that snack that's not always at the creamery, or that's not always packaged in one of those little clear bags in the bistro. I think they're called cookies. Or those little clear boxes, those desserts. Jim George is booing me. I'm going to call, Patricia, can I call you out and give your idea about having dessert? We talked about this recently, that she has been doing really good at focusing on her blood sugar. She has wanted to lower her blood sugar, and she has done a great job at it. She's my prize patient, my prize student for this week. But she told me that if she wants a dessert, she'll get one, but she will divide it into about 8 pieces. And then she'll have that sweet dessert, instead of having the whole dessert, which most of us are used to, she rations that dessert throughout the week. And I told her that's so smart. You know, when you want something a little sweet with that cup of coffee, just have that one section of dessert rather than the entire dessert. It takes discipline, doesn't it? Yeah, it has to be a dessert that she likes, not one that she doesn't like. But I just thought that that was such a great idea of, ration. You don't have to deprive yourself fully. Sure, fruit would be healthier, but if you want that dessert, I don't want people to live their life without dessert. Have that dessert, but you have to ration it. It doesn't need to be a dinner plate size portion of dessert or even a dessert box size portion. It can be a small portion. And that is what can help teach you discipline through eating healthy. So I hope you've benefited in some way and enjoyed or taken away little nuggets of information from some of these talks that I give. And I hope you learned something about diabetes today, healthy eating, and go enjoy Healthy Nutrition Month for the month of March. We're coming up towards the end of the month, but does anyone have any questions that I can answer in front of the whole group before we close? That's very smart. Yes, I did bring potatoes because they're a great source of fiber and they are still very nutritious, but potatoes are very high in carbohydrates. There are other vegetables that are high in carbohydrates. We think about some of those winter vegetables, things like the squashes and zucchinis are higher. So having broccoli is going to be a much healthier option than having a potato. But if you are in the mood for a potato, you're right, have half of the potato. Again, you want to think about your plate. You want to eat from a small portion size, and you don't want the majority of your plate to be all carbohydrates. You want to balance that out. Sweet and baking potatoes, or white, some people call them white potatoes. You know, we've been through the last several years, everyone says, stay away from everything white. White bread, white rice, white flour, white potatoes. Potatoes are still nutritious. You still get a lot of nutrients. And I actually yesterday was looking at the breakdown between a sweet potato and a baked potato. And it's interesting that you'll find higher fiber in one, but of course, sweet has a name of sweet for a reason. It is higher in carbohydrates than a white potato. But there are different benefits from each. So again, think about balancing portion size. Elaine. And eat the skin. That's really, yeah, probably to help the absorption of the nutrients of it too. So if you didn't hear, Elaine said one resource she recently saw or read was if you are in the mood for a potato, scoop out the majority of the white, the inside of it, and focus mostly on the skin of the potato and a little bit of the white, and maybe add some healthy fat to it as well. Yeah, potato skins. That is a great question. She's asking, do we refer to nutritionists and do most of our insurances cover? I do not know the answer about the insurance covering nutritionists. Medicare is tricky, and most everyone has some form of Medicare. Medicare wants to keep you healthy and keep you at home and keep you out of the hospital, but they also don't want to always pay for the things that we need. And that really goes for all insurances. So many insurances are gearing away from things that might provide someone with a healthy life, like chiropractic care, but they won't pay for physical therapy or they won't pay for massage therapy, but we know those things can be helpful for someone. I can refer to dietitians and nutritionists, and it's interesting that you asked because Courtney Bless from the Wellness Center and I have been talking about this. I know a handful of nutritionists. It's not an area that's booming. There's not a lot of help out there. Most hospital systems have very few, and they are inundated. I do know that we have someone here at River Landing. I think her name is Debbie Rosenquist, and we can do a referral to Debbie, but Courtney and I are talking about other resources that we can look into if someone wants something above that or in addition to that. And so we're kind of gearing up for that. I think the month of May, there's a wellness week in May, and I think that's Courtney's idea, is to bring in someone, a registered dietitian, a certified nutritionist who can come in and do some speaking engagements with everyone. Because like I said, that's a very dedicated training. My training is a very broad training, and I think that would be beneficial for River Landing. So I can refer you to Debbie here at River Landing. I have not met with Debbie. I don't know if any of you have met with Debbie. But I also say having one person for a large community like this may not quite be enough, so I am happy to refer outside of River Landing. We just need to get a good network. We just need to have that availability. Any other questions? Yes? You've got Elaine Frakes sitting 2 rows behind you, and I hate to point out Elaine, but I think everyone knows Elaine is your go-to lady. She is great at meeting with, and I think there's an entire group of you all who have met with the dining department and talked about the nutritional content of some of the foods. One of the things that I usually say during my talks is, I don't like cooking for 2 people. I can't imagine what it's like cooking for 600 people. I know it's very hard. Flavor is very important. You're either going to get foods that have no flavor, and people complain about no flavor, or you're going to get the foods that are full of flavor, but they're also full of everything else, the fat content, the calories, sodium, salt, yes. Blood pressure, if I had to guess, looking around the room, I don't know, you all aren't all my patients, but 90+% of people over the age of 65 have high blood pressure. And so the sodium content in foods is very important. And so I do know, Patricia, that there are some active groups here at River Landing that have worked with the dining department. So if we can put you in contact with someone, or if you want to join some of those conversations, we'll make sure we get you in contact with them. But you're exactly right. Well, thank you all for coming. I'm going to let everyone come up. I don't want a mad rush. I don't want anyone falling in the floor. But come up, take some green bananas home. I hear if you put them with an apple,